The numbers are staggering, but it's nothing new, unfortunately. The reality is the disproportionate impact of incarceration on people of color and African Americans in particular is longstanding. And it's a problem across this country. Unfortunately, it is probably the worst here.
The problem here in Wisconsin, like across the country, is that since 1980 or so, there's been a dramatic increase in the rate of putting people in prison.
And they didn't have drug treatment programs and so forth in prison, at least not to my knowledge, and it was not offered to me at the time.
First time I went to jail, I spent 9 months. There was no treatment of any kind. When I was released, I went back to doing the same things that I was doing.
The solution to the problem of drugs and the solution to that problem is not the criminal justice system. That we're never going to incarcerate our way out of drug problems in our country. It hasn't ever worked. And the damage that we're doing, and particularly the damage that we're doing in African American communities in central cities, the damage that we're doing to poor people is almost incalculable.
Wisdom, which is a faith-based community organizing network here in Wisconsin, approached Human Impact Partners about providing a health lens to that problem.
I knew about some of the work that HIP had done in Minnesota and approached them to see if they would ever be interested in doing an HIA regarding criminal justice reform. And they were excited about it, and we kind of worked together on a proposal and came up with this opportunity.
The premise for all the problems go beyond just the criminal justice system. It's just one symptom of a much bigger ongoing problem about education, socioeconomic status, ability to work, and the ability to get a proper education.
My son was, my youngest son, he was only 9, you know, and he went through a lot because he was displaced and had to go to all these different, you know, places, and where his dad didn't take care of him, so then he went to my mom, and my mom is really strict. I mean, it was tough on him too.
Because during that 8 years I was gone, I have a daughter and 8 grandchildren. And when I went in, I thought my daughter would be there for me, but during that period of time, I thought everything was fine, but in reality it wasn't. She was hurt.
The health impact assessment that Human Impact Partners did was really clear in showing that the children of the men and women who are going to prison unnecessarily are suffering, and that whole communities and economies are suffering as a result. So it's not just the individual, it's not just the one guy who did something, but it's all the people that he's connected to, and it's the whole neighborhood that he's connected to, and it's the young people who don't have role models around, and it's communities that have just lost big parts of their population.
What we're asking is we take a comprehensive look at what we've been doing in the past, and is it the most effective way to change people's behavior?
Our stated goal that we picked up back in 2011, that we decided on, was that our state should cut its prison population in half, from 22,000 to 11,000 by the end of the year 2015. So that's why we call the campaign the 11 by 15 campaign.
11 by 15 could save the state and the state budget by reducing the recidivism rate.
So we looked at the ability to recover from substance abuse, the ability to manage your mental health outcomes, the not committing crimes again, staying with your family, and making communities stronger. We looked at all of those things, and usually in a health impact assessment, you know, there's trade-offs. There's some things that are better for health outcomes, some things that are worse for health outcomes about a policy. But in this situation, in all of those issues, the treatment courts showed much better outcome.
Our current governor and legislature, very conservative Republican, have passed big increases in treatment alternatives and diversions, and they themselves are coming up with some new ideas of how to make use of precisely the information that's in the health impact assessment.
By studying the 12 Steps program and so forth, it led me into a whole different way of thinking in life and so forth, and gave me a whole better understanding of who I was.
We feel we've really made a breakthrough by getting the increased commitment to treatment alternatives and diversions. Now we need to expand out to deal with some of the other parts as well of the criminal justice system, though the particular campaign that the health impact assessment was about, treatment alternatives and diversions, continues. That's going to continue on for years.